Florence Nightingale, the founder of modern nursing, said, quote, "Nursing is one of the fine arts. Nursing comes in many forms, and many of which one local nurse has practiced." KX News' Alicia Huck introduces us to her in this week's Someone You Should Know.
Someone You Should Know is sponsored by First Light Home Care of North Dakota.
Whenever you hear a sound in the headphones, you need to put your hand way up in the air.
Kate Gartner has always enjoyed working with kids and started her career as a classroom teacher in Killdeer in 1997. While no longer a teacher, Kate's back in the classroom. Her path of getting to where she is today started when Kate decided to explore her love of science.
I love science. I'm a science nerd, and I always wanted to go into medicine. But I also love teaching.
Kate got her nursing degree and started as a nurse at Sanford Children's Hospital. She then went into pediatric oncology and later became the first nurse manager at the North Walk-In Clinic in Bismarck. But after a few years, pediatric oncology was pulling her back.
That was always my big love, just the different way of having to think and the critical thinking that goes into pediatric oncology.
Kate says being able to help a child who's experiencing more than what many adults can handle was one of her biggest motivators.
Just knowing that you've had that effect on a child, that instead of being afraid of going to the clinic, they're actually looking forward to it, even though we're doing back pokes and portacath pokes and all that stuff. They still enjoyed coming.
Kate's career came full circle when the position for a school nurse coordinator for Bismarck Public Schools opened in 2017.
That's kind of always been a dream of mine, to be in the schools, because it kind of meshed both of my careers together.
She started the job just 2 weeks before school started.
It was a crash course, definitely, for me to learn the position and manage my time to get all these places.
Then COVID hit.
How did you manage that?
I honestly don't know. I would start receiving calls from parents and staff around 6:30, 7 o'clock in the morning, wondering if they could come to work, if their kid could go to school.
And the work continued through the summer months.
That summer, my husband and I got a spot out at Lake Shida, and I can't tell you how much contact tracing I did in the middle of Lake Shida on our pontoon, because if I got behind by a day, I couldn't dig myself out.
When ESSER funds were offered to schools to help address the impact of COVID-19, the district asked what she needed.
I really need help. I need more nurses.
The district hired 3 additional nurses for 3 years with those funds.
It was absolutely wonderful having them. And those schools had never had nursing other than myself running to put out fires now and then. And so they really didn't know what they were missing until they had it.
While her plate may be flowing over, so too is her love of helping students, their families, and staff.
Doing the hearing screenings and the vision screenings when I get to actually be with the kids, I love that. I'm also the special ed school nurse, so all the kids on IEPs that have medical conditions, I help write their health plan, I help train staff. I get to watch them grow.
Kate's also a problem solver, taking complex problems and finding solutions by thinking outside of the box.
We've had a huge influx of students from other countries, and some of them have big medical issues, and they get to America and they have no medical coverage, and they're going to run out of their medication by the end of the month, and so we need to get them medical coverage. I just help with bridging those gaps.
By doing so, Kate gets to see the difference she and her staff can make in the life of a child.
I've got a kiddo now who's in junior high who in kindergarten was in a wheelchair all day, every day, and now he's walking with his walker, and sometimes even without his walker a little bit, all over the halls of the middle school. And so seeing that kind of thing is so much fun, seeing these kids grow and just thrive.
Kate Gartner, a nurse who strives to keep kids healthy so they can achieve academic success and more, is someone you should know. Reporting for KX News in Bismarck, I'm Alicia Huck.
Outside of her career, Kate really enjoys Legos. As you can see, she has an entire Lego garden, which she likes because it doesn't require watering. Same, Kate. Kate is also on the board of the Bismarck Mandan Civic Choir, sings in the choir. She also enjoys spending time with her dogs and reading. And if you think there's someone we should know like Kate, fill out our nomination form over on our website.